Moving on to the scope of the problem. So the scope of the problem in one word is huge. In the US, 750 people over the age of 65 are hospitalized every day for serious side effects from one or more medications. In the last decade, there have been about 35 million emergency department visits and 2 million admissions for serious adverse drug events in older people. And there are a disproportionate number of people over the age of 65 hospitalized for adverse drug events. They make up about 14% of our population and have 56% of those admissions. Polypharmacy in children is understudied and needs more research, but they do show that it's a growing issue. There was one study looking at a medication reconciliation program, and it showed that out of 2.7 million clinic visits, about 26% of those pediatric patients had one or two medications, 22% were on 3 to 6 medications, and 11% of those kids had 7 or more medications. And with an updated medication list at the end of each visit, there was actually a 29% increase in the number of medications prescribed. And with kids, there's a lot of uncertainty around adverse and long-term effects of multiple medications. Many drugs haven't actually been studied in pediatric populations, and their use is considered off-label for kids. As more kids are diagnosed with complex medical issues and more medications become available, the risk of polypharmacy rises.